Hello, my name is Stephanie Latoski, and I'm here to talk to you about the important aspects of language assessment for school-age children. We as speech-language pathologists assess children for language disorders to evaluate the child's strengths and weaknesses in receptive and expressive language to see who might benefit from language therapy to try to improve on these skills. The steps for a comprehensive language evaluation are a classroom observation, a case history and parent interview, a hearing screening, an oral mechanism exam, a variety of standardized assessments, and a language sample or different criterion reference assessment. The first step for this evaluation is to assess the child in his or her regular education classroom. Classroom observations can give you a ton of information about the child in his or her natural environment. Is he raising his hand in class? Is he interacting with his peers? Is he completing classwork on time? Does he seem to understand directions from the teacher? Are there any articulation or phonological issues going on? Finding out how the child is in his typical classroom can determine how he is acting in a natural setting when he doesn't think he's being evaluated. This can also give you somewhere to start with the evaluation. Following the information that you've gathered from the classroom observation, receiving information from a parent or caregiver would be the next step and should be completed prior to beginning on the diagnostic evaluation. You need to have any knowledge of any previous diagnoses of any disorders, previous evaluations, treatments, or services from other professionals, any previous or current medical issues, linguistic or cultural information, and a description of the child's social environment, play activities, and educational strengths and weaknesses. Knowledge of all of this case history information should be established through completion of a form and an interview with the parent or caregiver. Information on the child's likes, dislikes, the amount and quality of the language the child is using at home, and where to begin assessing can be obtained during the interview. The primary concerns of the parent or caregiver must always be addressed during this time. The next step could be to complete a hearing screening to rule out any deficits in hearing that could be causing any issues with the child's language. If the child does not pass the screening, the child should be referred to an audiologist for a full hearing evaluation. An oral mechanism examination, commonly known as an oral mech or oral peripheral exam, could be the next step in your language evaluation. This is an evaluation used to assess the physical condition and function of the structures used for speech, the general facial symmetry and appearance of facial structures, breathing patterns, labial and lingual strength and range of motion, teeth alignment and dental occlusion, appearance and function of the hard palate, soft palate, uvula, facial arches, tonsils, and pharyngeal area, and the vocal quality are all assessed. This evaluation is done to rule out or assess any structural or functional deficits that might be occurring that is creating issues with the way the child is speaking. The next step is to decide which standardized assessments you want to use to evaluate the child's receptive and expressive language skills. Two good comprehensive language tests are the Clinical Evaluation of Language Fundamentals, or the CELF, and the Test of Language Development Primary or Intermediate, or the TOLD-P or the TOLD-I. The CELF is used to quickly and accurately identify and diagnose language disorders through evaluation of the child's receptive language, expressive language, language structure, and language content. Both the TOLD-P and the TOLD-I measure the features and systems of language including spoken language, listening, organizing, speaking, semantics, and syntax. Choosing between these simply depends on the child's strengths, weaknesses, and individual needs. You as an SLP can decide which test is right for your client by researching exactly what is evaluated in each of these tests. There are also many different tests that can assess receptive language, expressive language, or both at the same time. If the child has any noticeable issues, a parental or classroom teacher concern, or a referral involving articulation or phonology, you would perform another standardized test in this area. A good example is to complete the Goldman-Fristow test of articulation, followed up by the Kahn-Lewis phonological analysis. If there are not any issues in this area, there is no need to test it. Lastly, you would want to do a criterion reference assessment to further evaluate any issues that were noticed in any other parts of the evaluation. If language is the main concern, a language sample should definitely be at the top of your list. After obtaining a language sample of 50 to 100 utterances, you can figure out different analyses such as number of different words, number of total words, T-units, and MLU to further evaluate the child's current language skills. After the completion of a comprehensive assessment to evaluate a child for the presence of any language disorders, a treatment plan may begin. The levels of performance in all of these areas can assist in creating therapy goals and intervention strategies.